Hello and welcome to episode 8 of the Life Without Limits podcast series from Bailey Medical Center. Today's guest in studio is Dr. Katherine Gaffney, and she's going to talk about her experience in internal medicine and how she found herself working with bariatric patients and now has a new calling for enlightening not only patients but the medical community in general about this disease process known as clinically severe morbid obesity. Please stay tuned. Hello and welcome to the podcast. My name is Russell View. I'm the bariatric liaison here at the Center for Bariatrics at Bailey Medical Center. And we are so very pleased to have joining us today Dr. Katherine Gaffney. Dr. Gaffney works in the Bariatric Center directly with patients. And with that, Dr. Gaffney, would you please take a moment to tell us a bit about yourself, who you are, where you went to school, and that type of thing?
Sure. I'm Dr. Katherine Gaffney. I'm an internal medicine physician. So my role in our bariatric clinic is to guide the patients through all of their safety clearances, to reinforce all of the education that they are getting from all of the other providers, and just to reinforce the bariatric habits, and also to make sure that people are have really good nutrition and health overall before surgery and after surgery. So we're kind of the quarterbacks in the pre-op process, and then we assist the surgeons with the safety aspect of it. And let's see, where did I go to school? It was a long time ago. Sure. I went to medical school at Oklahoma State University College of Osteopathic Medicine. I think the name might even have changed now to something else. It was so long ago. And then I trained at Scott & White, which is in Texas, which is now Baylor Scott & White. Again, I'm aging myself because all the names are changing. And then I've been practicing here in Tulsa in primary care for 16 or 17 years. And then in the bariatric clinic, I've been here about 2.5 years.
Very good. Thank you for that. Can you explain to us why you chose to go into the medical field?
Well, I would like to say I had a big altruistic aspirations of helping people, and I do, but I come from a family of doctors. Both my parents are physicians, both my sisters are physicians. We're all married for physicians, so maybe we'll call it peer pressure. I'm not sure, but this is just what, science geeky kids do when their parents are doctors, as we become engineers or doctors. And I couldn't do the hard science that was engineering. So I'm all kidding aside. I love being a physician, and I felt called to do it for a long, long time, but it's a family thing.
That's the family trade. I understand. And then bariatrics, what got you into the specialty of bariatrics?
The bariatric program approached me. My husband has been doing the cardiology clearances up here at Bailey Bariatrics for some time. And of course, I've heard all the wonderful success stories, and I've had some of my primary care patients have bariatric surgery, and I've seen them be very successful. But just the timing worked out where I had an availability in my life and my schedule at the time where Bailey Bariatrics had a need for me. And so it's a little bit of on-the-job training over the past couple of years, but I've really enjoyed the challenge and enjoyed getting to really know the patients on a very personal level, because this is such a personal subject. And we get to take a little bit more time than in primary care when we're more focused on every single aspect of something. So it's been very rewarding being up in bariatrics.
Well, we're certainly grateful to have you. I get nothing but compliments from patients on you constantly. Will you describe your goals when it comes to educating the medical community about the disease process that is morbid obesity?
Well, there are just some alarming statistics that we can go through about the rate of obesity, the overwhelming increasing obesity, how this next generation is not going to live as long as our predecessor. So there's a very disturbing trend in America, actually the world, but America and Oklahoma. So we're kind of living in, we call it the barbecue belt, some of us, right. Where it afflicts a lot of our patients. And I think the challenge of being a primary care doctor or even a specialist is you have, a 15 to 30 minute appointment to address everything, all of the chronic illnesses, all of the cancer screenings, health maintenance. And it doesn't leave a lot of extra time other than saying, you've gained weight, you need to eat less, exercise more, which most of our patients who've struggled with obesity, many since childhood, have tried eating less and exercising more many times over.
Right.
So, it's also a very personal subject, and it's very hard to know how comfortable the patient is in addressing it. So my sister actually educated me this, who's an endocrinologist. She says you should always preface it by saying, are you comfortable talking about your weight to a patient? And sometimes the patients are waiting to talk about it. Like they're very concerned about their weight, and sometimes they're not there yet. So I think taking the time and telling people what their options are, but really also, I think that we've been treating it in medicine. We treat it more as a willpower issue and a vanity issue instead of the dysmetabolic issue that it is. And the truth about obesity is that it is a chronic progressive relapsing condition. And if you don't prevent it, it will get worse over time.
Right.
So we have so many people in that overweight category where their BMI is 26, 27, which is just like, for Oklahoma, we kind of call it Oklahoma skinny, right? So if you can really educate those people, like you've come in for your yearly physical, and even as a younger person, but you've gained 5 pounds every year, which 5 pounds over a year does not seem like a lot of weight, but over 10 years, that's 50 pounds.
Right.
So that significantly increases your risk of type 2 diabetes, sleep apnea. We also don't educate our patients that 40% of cancers are linked to obesity. There are so many, and it's cancers that you wouldn't even think of. It's thyroid cancer, multiple myeloma, kidney cancer. There's so many aspects about obesity and chronic disease that are interconnected. But just the nature of the way our healthcare system is designed to be, we tend to more just tackle the chronic diseases and treat them as they come up without really taking the time and effort to help the patients address the main underlying driving issue of the chronic diseases.
Right.
So it's a challenge for the primary care physicians, and it really should be dealt with probably earlier than we deal with it.
Do you find that you still run into a lot of the old stereotypical belief that if you just exercise more and eat less, that'll resolve the issue, even amongst providers, medical providers, that sometimes still prescribe to that old thought?
Well, I think, because that's partly true. No weight loss program works if people aren't adhering to it.
Right.
So I think the nature of obesity, though, is when you are obese or even actually overweight, there are so many changes that go on in your body. And I think what we all kind of think, we can gain weight and we can be 50, 100 pounds overweight. And then someday we're going to get our stuff together and we're going to be able to lose it and keep it off. Just if only when my kids quit going to sports or this, that, and the other, if only I could work one less job.
Someday.
So we always try to delay our health, but the metabolic consequences of obesity are that when we lose weight, we only have 2 things in our toolbox. We have diet and exercise, or increase energy intake or decrease energy intake and increase energy expenditure. But when we do that, our body makes compensatory changes where our metabolism slows down, our hunger hormones go up, and our satisfaction hormones go down. And it's probably way even more complex than that. There are 50, proteins and neurotransmitters and things that we even have discovered, some are not even named yet, that affect hunger, satiety, and metabolism. So it's a much more complex disease than calories in, calories out. A calorie is only a calorie in a lab, I tell the patients. In your body, a calorie is way different. But that is why one of, all of the biggest losers, I tell the patients, they all have gained their weight back, because trying to maintain an over 100-pound weight loss on your own without help with medicines, intensive diet and exercise, it can be pretty overwhelming with the American lifestyle.
Right. Very good. Thank you. Can you describe for us a most rewarding story or moment that you've had in bariatrics?
Oh, I've had so many. I love a certain patient, and if he's listening to the podcast, he knows who he is, who he started out at well over 500 pounds. I do leave over 600 pounds. And in our specific program, our weight limit to have surgery is 500 pounds, because that is what our equipment will allow us to do the safety testing for the patients to be safe. And it's pretty daunting when you come in and you think you're going to be able to have surgery to lose this weight. And then someone tells you, you need to lose 100 pounds over on your own. And he just really embraced the challenge. I did help him with FDA approved weight loss medication because he also had diabetes in the form of Saxenda. So he did have help, but he put so much effort into, he got into the gym and he lost the weight, and it really did not take him long. He made pretty quick progress, and he's had surgery and he's reversed almost all of his comorbid conditions, and he's so much more mobile and so much happier. And he was a younger man, and I feel so hopeful for him. He was feeling so hopeless about his future, and now he feels so hopeful about his future. And then I will also have so many people who, they were not, that heavy, but they were heavy enough where they didn't love fitness. And now I have so many patients who, like, that's their thing, is they love going to the gym and they can do all the burpee, they can do more burpees than I do, and I have a trainer. So I love seeing those stories of the people who really are fully embracing their lives after surgery, which is actually more common than people not. So Too many success stories to count.
Well, very good. Thank you for that. What would you say has been the biggest challenge of your career?
I think, I've had a lot in my career, but regarding bariatrics specifically, I think the challenge is just imparting the knowledge that I've learned about obesity as a disease and getting people to regard it differently, to get people to be open to discussing it. And then also just understanding and have the patients understand that, yes, the surgery is a tool. There is no cure for obesity. It is a chronic progressive relapsing condition. So you have to treat it almost like a cancer in remission. You have to keep all of your follow-ups. You have to keep all of your habits that helped you get into remission. And that surgery is a tool. It is a successful tool that you can use, but you still have to maintain your healthy habits and remember why you're doing it. I think we have so many young people now getting the surgery, which I am actually for, because their surgical risk is so much lower. But, and then why are we waiting until we're on dialysis and need a kidney transplant, and we have bone-on-bone knee arthritis and we need a knee transplant? So I'm not against my younger people having surgery, because I think there is a lot of pluses to that. But you also have a longer time to maintain those habits, and just keeping people focused on why they should be focused on improving their health and keeping in the post-op bariatric habits, I think, to me, is the most challenging part.
Very good. So what words of wisdom would you have for somebody that's out there listening now that's kind of on the fence about bariatrics and bariatric surgery? What would you say to them?
Obesity is a complex disease. And yes, your habits make a huge difference in how successful you're going to be and how healthy you are going to be. But I'm really passionate about people's health, and you cannot view someone's weight or BMI in a vacuum. And I tell people the 4 main building blocks of your health are nutrition, exercise and fitness, stress management, and sleep and recovery. And you really have to approach them as intertwined and not individually. So we can't just focus on nutrition. We can't just go to the gym, but eat whatever we want. We always have to make sure that we're getting enough sleep. And that is why we have specialists in our program in all of those areas to help people, because when COVID hit, we were already a pretty unhealthy country. And then this is pretty classic, where we were all under stress. And what we should have all been doing is doubling down on our other pillars of our health. So doubling down on nutrition, doubling down on sleep, doubling down on exercise. But what most of us did, a few people did that. What most of us did is we really struggled in all of those, and we actually got unhealthier during a health emergency. So I think if you are at a time in your life where you can really embrace a major life change, and I tell people, I think surgery gets a bad rap as cheating. Surgery is not cheating. Having surgery changing a lot of long ingrained habits, and even changing your mindset about food and prioritizing your health, it takes a lot of effort and work. And there might be better times in your life to embrace that change than others. So if it is a good time in your life to embrace a major change and you are facing challenges where you think, if I don't do this, I'm not going to be here for my children and to do all the things that I want to do, then I think you should educate yourself on all of the options that are available to you to treat that. And even if it's not the best time of your life to do that, just educate yourself about health in general and really say, if I've been gaining 10 pounds every year, this year, I'm not going to gain 10 pounds and I'm going to try to lose 5 pounds, and ask the medical community for help in doing that. And yes, will you have to put in some effort? Absolutely. But will it be worth it? Yes. Surgery can radically change your life and extend your life, but even losing 5% of your body weight has shown to give you a health benefit. So even just doing that, making small changes over time. But I think people regard bariatric surgery as quote unquote cheating and a last resort. And I don't think it should be the first thing that people should resort to unless they have a significant amount of weight to lose, and usually accompanied with comorbid conditions. So it's not for somebody who needs to lose 20 pounds or 30 pounds. When I say the term obese, I use that as a medical term. And it's, when people hear that, they don't understand that's a medical term. So you have to learn what your height and weight is and where you are in that spectrum of your health. So, and body mass index is how we define that, but it is not it's not the end all be all, because especially if you're a younger muscular male, your body fat percentage is a much better indicator. But generally speaking, there's apps for it, look it up on the internet. If you have a BMI of 19 to 25, that's considered a healthy body mass index. 25 to 30, we used to call it overweight, but now we call it pre-obesity, because if you get into that range, your chance of becoming obese is pretty significant over time. 30 to 35 is considered grade 1 obesity. Over 35 to 40 with a condition related to obesity, especially sleep apnea and type 2 diabetes, that would be a reason to look into metabolic surgery or bariatric surgery, or a body mass index of over 40. So a lot of people have no idea what their BMI is. And it's helpful to define that, because when Americans hear the word obese, they think of the word ugly. This has nothing to do with looks. This has nothing to do with cuteness or anything else. This is just like your blood sugar and your blood pressure. These are metabolic things that everyone should know. Like when you go to the doctor, you should know your blood pressure. You don't take it as a personal insult if your doctor says your blood pressure is high. So be open to discussing it as the metabolic disorder that it is, and also being your own health advocate for asking for help.
Excellent. That makes a lot of sense. Tell me, how have you adapted at your job to specifically take care of the bariatric patient?
So I've learned from all of our providers. Our dietitians are incredible. They've turned me on to so many health foods that I didn't even know existed,
right.
That I've used even in my own life for my family. Our exercise people are super motivating. Because if you don't exercise after surgery and your metabolism, the metabolic changes will be even more. So really that's how you keep your metabolism up, is through increasing your muscle mass through exercise. And they're just so motivating at that, and actually really knowledgeable about what your target heart rate is and how to adapt. So I kind of underestimated how scientific that was. But when I hear the patients talk about like, oh, my muscle mass was this last time and it was this time. So they told me to do something very specific, like a specific change before exercise, or train at a different heart rate. So there's so much science involved in that, and so much knowledge that our exercise physiologists are able to impart to our patients. But also I've learned a ton from them.
Right. We all have.
Yeah.
In the years that I've been here, I thought I knew something about that. And then you realize just how much misinformation.
They're not just muscle meatheads. They're actually really crazy smart at physiology.
And I find it interesting that you can almost prove any point you want to make by going to the internet.
Well,
but
this is true.
There's so much misinformation out there. And you really have to deal with people who are in that line and know exactly what they're talking about to know you're getting the proper information. I love the staff.
And our psychology component is amazing because I think people don't really realize the vicious cycle of our poor diet has overall on our health. But there's a definite link between obesity and depression. And, so sometimes you think, well, am I just depressed because I'm overweight? But people don't understand how important it is to eat healthy in your gut flora. And 80% of your serotonin is made by the bacteria in your gut. And your gut bacteria changes based on really what you're eating. So when people eat healthier, just by function of that, they will actually have probably improved mood and mental health because of that gut bacteria change, which is fascinating. It's actually very fascinating physiology overall in the body of how much is intertwined. And it's not, I tell people a calorie is only a calorie in a lab. In your body, it's completely different. So, we have free will. If we were all locked in a little glass box and we ate only 3 Twinkies a day, we probably would lose weight because that's a quote unquote calories. But would we feel good? Would we feel energetic? Would our metabolism be good? Would our gut flora be healthy? And would we be starving? Because that high fat, high carb combination, it actually is so positively reinforcing in the brain. And it also makes you resistant to your fullness hormones. So there's so much education that goes on in this program that I think it can benefit everyone's family. I try to tell people, teach your kids this, teach your kids how bad soda is for them, because we're a consumer nation, and I have no problem with that. I love shopping and consuming too, but you have to be an educated consumer because we're being lied to by the food industry. And I feel very passionately about that. And we're doing damage to our bodies that is really hard to undo.
What's the most important thing about coming in for your follow-up appointments and the appointments before surgery for the patient that's just starting? What are they going to get from those appointments? Why is that so important? And then following surgery, you've hit on that, doing the follow-up. Can you kind of elaborate?
Well, in the pre-op process, I think it's important just to have the accountability of how quickly you're getting down the preoperative habits that we want you to get into. And some people pick them up quickly, and then some people, they struggle with it. So it's important to just really practice those. And the longer you spend in the pre-op process mastering those, the better off, the safer and happier and better you're going to feel post-op. Post-operatively, the 2 main long-term complications of bariatric surgery are low vitamin levels and low protein levels. So keeping your food journal, to me, is the most important bariatric habit, both pre and post-op, because that, if you're not keeping your food journal, that's like driving your car without looking at your speedometer. You really don't know where you've been, where you're going, and how fast you're going to get there. So you can't make any corrections unless you're keeping a food journal. And I'm not going to pretend like that is easy, but it is a very important habit. So post-op, I think it's important to follow up to make sure that you're maintaining your muscle mass, because we have a special body composition scale, because just like a calorie isn't a calorie, isn't a calorie, a pound isn't a pound, isn't a pound. And so sometimes people feel like, well, I'm not losing any weight, but they've really been working out hard and they've lost body fat percentage and gained muscle. That is really informative and also can be very encouraging. And conversely, if you haven't been working out and not getting your protein and you're losing muscle, you might think you're doing better than you actually are, where you need a little bit of reinforcement on what to get back on track there. And then also to get your lab work and your vitamin levels checked, especially with our Roux-en-Y gastric bypass patients. That's a very important part for your long-term health, because those are a lifetime commitment. So that's why I think the pre-op and the post-op follow-up is so important.
Very good. Well, listen, I thank you so much for taking time out of your busy schedule. Is there any closing comment or anything you'd like to add for anybody out there listening?
Well, I think I've said it all. I'm very passionate about this subject. I think that I've noticed an interesting trend from when I was a child, and I'm just to date myself, how old am I? 52. So when I was a kid, we'd have we called them the walker ladies in the neighborhood. And there were a lot of normal weight people that were just doing everything in moderation. They just walk a few miles a day and ate kind of healthy. If you look around now, look at restaurants and look at airports, you'll notice a really significant trend of people either are obese and look significantly unhealthy, or they look like they could be on the cover of a fitness magazine. There's very few just in between normal people anymore. It's a really interesting phenomenon that I've noticed. And I think that we just need to be a lot more proactive in medicine about discussing this topic of overweight and obesity. And we need to be addressing it earlier. And it's a difficult subject to talk about. So I think we need to be more open to treating it as a medical disorder and metabolic disorder. And physicians need to be more willing to talk about it and strategies to combat it and prevent it. And the patients need to be more open to talking about it for their own benefit. Because we have some majorly disturbing trends going on in the nation. And COVID was a little bit of a wake-up call, I think, because obesity was a significant risk factor for having severe COVID. And that should have been a wake-up call for all of us of wow, we really need to get ourselves together.
That's right. Yeah.
And I will tell patients, no one can care more about your health than you do. I care about your health. Your doctor cares about your health. Your spouse cares about your health. But you have to care the most about your health and take the steps to correct it. And that includes having personal responsibility for your choices, but also being your own health advocate and addressing anything that you can do to combat your any chronic disease. And obesity is considered a chronic disease. So combat your obesity.
Absolutely. Well, thank you so much for that. I know I caught you kind of off guard at that last one.
That's all right. I ramble on. So just free feel to edit it out.
You did great. Well, listen, once again, that was Dr. Katherine Gaffney, works here at Bailey Medical Center in the Center for Bariatrics. And I'm Russell View. I want to take a moment to thank you for joining us. And we look forward to doing additional podcasts in the future. Have a wonderful day.
Thank you.